Having confirmed that the Western Cape is officially in a third wave of COVID-19, the province says it's prepared to deal with the surge. The Western Cape has now joined the Free State, Gauteng and Northwest, as well as the Northern Cape, as provinces confirmed to have entered a third wave. The province has seen a rise in hospitalisation as well as deaths. Now, for more on the Western Cape's response to the third wave, I'm joined by Premier Alan Winde. Good afternoon to you, Premier. Thank you so much for joining us.
Good afternoon. Thank you very much for having me on.
Now, the Western Cape is officially in its third wave of infections, with double the number of active cases being seen than they were recorded last month. Can you give us the latest on the situation on the ground?
Yeah, so, we announced on Thursday that we were entering the third wave. And, these numbers are increasing every single day. So our reproductive rate is now sitting at 1.2. So definitely that is a good sign or indicator. Our reproductive positivity rate, we're now sitting at 11.3%. And so that also continuing to rise. It was sitting at 5 and 6% for quite a long time and now slowly climbing. We look at the indicators like you've just mentioned, our hospital numbers. So we're now sitting at 1,068 in our hospitals. These numbers are also continually climbing. And just in the last day, we went from 6,108 cases to 6,430. So you can see the cases climbing. Mm-hmm. And then our other indicator is our oxygen use. So we're using 28 tons of oxygen a day now. Which is about 40% of our capacity of oxygen manufacture, and you can see that number is climbing too. So obviously all of these indicators are showing us that we're moving from resurgence into the third wave.
Now, Premier, the hospital occupancy has increased to about 94%, as you've mentioned earlier on. How are the hospitals dealing with this pressure and the increased demand for oxygen for patients?
So remember that the total occupancy is not COVID-19. Our occupancy in our hospitals is still quite low of the COVID beds. But remember, every time that number increases, you then have to displace other, there could be elective surgeries that you have to start slowing down. You have to find other mechanisms for, helping people get in with COVID, because you've got to stop some of the other hospital bed visits. And that's obviously where the pressure starts to build. We still have a little bit of a buffer, and then we also still have our field hospitals, which the number is really low. We've only got the Hospital of Hope with a few patients in it now, and we've got a number of other COVID hospitals that are sort of on mothballs at the moment, but ready to open should we need. But you can definitely see that pressure is rising.
Now, another area of concern is the rural districts. What plans does the provincial government have in place then to deal with the case surges in those areas?
So, we have a management system. We call it the hotspot management system. And we also revived that again about a week and a half ago. So the management systems are being put back in place. All of the preparedness that we had in place across the province in all of our rural areas, those extra beds that we put in place, the extra oxygen tanks, etc., are all still there. So the readiness is still available. We have kept the extra staff on board, although we now need to probably look at even more staff, because we now got to find a balance with dealing with COVID-19 patients, but also many of our frontline workers have also been repurposed to help with the rollout of vaccines. So we've also got to get that balance right. But we've got all the systems in place, and we will just open them up as we need to.
And just speaking of the vaccine rollout, how has that been progressing in the Western Cape, and are you hopeful that you'll reach your targets, especially with vaccinating the elderly by the end of July?
So already with the Johnson & Johnson, issue about the FDA, we were supposed to do 120,000 vaccines this week. And so I'll get the final numbers today. Still, we'll just be around about 70,000 as opposed to the 120,000, because we were supposed to already be using Johnson & Johnson and Pfizer in the rollout. But up until now, we've had our targets, and we've surpassed those targets every single month. And I see that only 2 provinces are sitting above the national average percentage, and that's KZN and the Western Cape. So I am happy that the numbers are looking okay, but I think the Johnson & Johnson blow now that the FDA ruling has come along with is going to be a problem for getting those numbers right. So obviously we really hope that we see there's 300,000 emergency Johnson & Johnson vaccines coming along, but we should be a few million vaccines in the system already. So I really hope that we can find extra resources of those vaccines, because otherwise we're going to be delayed, and then I think that the whole country is going to be under pressure to reach those targets by the end of the month.
And in terms of the death rate then and the recovery rate, what are the latest figures?
Okay, so remember that as the infection rates go up, the death rate is a sort of further knock-on effect. It comes later on. And so, yeah, those numbers still we won't see the rising sort of in parallel just yet. In a few weeks, you'll probably start to see those numbers rising. So they are still fairly constant. Of course, they do go up slightly. We're not sitting at 0 and 1 anymore every day. And we're also looking at the excess deaths. We work very hard at making sure we match the excess deaths and the actual tested deaths, and we do testing in our mortuaries. So those numbers will start. We had some corrections now in the last 3 days where you saw 6 deaths and 7 deaths being added up on the different days. And those numbers will start to increase now, but probably with about a week's delay on the infection rate.
Now, Premier, our reporter Yazid Kamaldeen has been to different locations throughout this morning, and at places like the market, for example, we noticed that little to no social distancing was actually taking place. Would you say that maybe some residents of the Western Cape are beginning to experience COVID fatigue?
Yeah, absolutely. I mean, that's been the call now for the last while to say, please, we mustn't be complacent. We have noticed that people are not as vigilant as they were. People were relaxing because we'd sort of come into this lull post the second wave. And quite frankly, the messaging now is we really need people to play their part. This is a partnership. We must make sure we've got the hospital beds and the oxygen and the nurses and all of that side of this deal in place. Citizens have got a role to play as well, because we can only do this together. And we want to try and avert having too many blunt instrument measures for slowing the curve or slowing the virus spread in protecting those hospitals. And that's obviously where these curfew blunt opportunities come in. And I'm really asking citizens to play their part. If they play their part, then obviously it makes it much easier from our side as government.
Well, lastly, Premier, just be more specific in how citizens should be playing their part. Is it reducing those super spreader events, like perhaps gathering after a funeral service has concluded?
Okay, well, absolutely. I mean, people know that there's no after tears. We must really, keep that. We must try not to do that at all. We know that even we've been advocating already for those numbers. We say 50 people on an inside gathering, 100 people on an outside gathering. And if you can go lower than that, please do that. And then, of course, the other thing is when you arrive at a place, you might be going to a restaurant, you might be going to a gathering in the park. You've just mentioned the market. When you get there, please, if you see there's congestion, people are not social distancing, actually don't enter. And if you have the opportunity, either let the authorities know or speak to management. And my message is to management, whether you're managing the local market, whether you're managing the local whatever it is, a store, a business, please, as managers, you also need to be playing your part and making sure we all know what to do. It's not as if this is something new. We need to get those habits back in place.
Well, let's leave it there for this afternoon. And that's Alan Winde, the Western Cape Premier, just giving us the latest when it comes to the COVID-19 figures and the response of the Western Cape.